Hello, everyone. I'm Denise Absher from the Ryan White Data Support Team, a team contracted by the HIV/AIDS Bureau HAB to provide technical assistance with the Program Terms Report, PTR, and the Expenditures Report. Today, my colleague Brian McBee will review how to complete the Part B and Part B Supplemental PTR. At the end of Brian's presentation, we'll have a question and answer session. Before I turn it over to Brian, I would like to answer the most commonly asked question. When will the webinar recording and the 508 compliance slides be available? We'll send the link to the recording to you in about a week. The 508 compliance slides will be sent to you shortly after that. So let's go ahead and get started with today's webinar. Brian, take it away.
Thanks, Denise. And thank you, everybody, for joining today. So here's the outline for today's presentation. We're going to start off with a little background information, and then after that, we'll go through some step-by-step instructions on how to access the report. We'll briefly go over the Grantee Contract Management System, or GCMS, and then review how to complete various sections of the PTR. Finally, we'll close out the presentation by looking at some resources and then wrap up by answering any questions. Before we start, I do want to take a moment to mention the updated instruction manuals for FY26 for both reports, Part B and Part B Supplemental. The FY26 Part B PTR manual is available now on the HRSA website. And the Ryan White Part B Supplemental Manual will be available soon at the same link. The manuals are the best resource for you when you're completing your report and contains instructions and all the information we're going to go over today. So let's get started with some background information. All Part B X07 and Part B Supplemental X08 recipients are required to complete a PTR for each of their awards. You'll complete a separate PTR for each one that you receive. So if you have both a Part B and a B Supplemental award, you'll have two separate PTRs that you need to do. In the PTR, recipients report on the allocation of their grant funding for the budget period. And this report is accessed and submitted through the HRSA electronic handbooks, or EHBs. The PTR is one of the few reports in the EHBs that uses the Grantee Contract Management System, or GCMS, which we are going to go over a little bit more later in the presentation. Looking at the submission process for the PTR, you'll start by accessing the PTR system through the EHBs. After that, you'll need to complete the PTR, which includes adding your allocations for core medical and support services to contracts in the GCMS, and then completing all required fields in the actual PTR itself. Once you've done all of that, you'll validate your report against HAB's reporting requirements, and then submit it to your project officer for review. We're going to go over each of these steps more in depth on the upcoming slides. Before we jump into our instructions for accessing and completing the PTR, though, I do want to mention one really small update which was made for FY26. This takes place in the Part B PTR. The term ADAP earmark has been replaced throughout this report by ADAP base. So this is just a little cosmetic terminology change that you'll notice in a few spots in the allocations report, but there's no change to how you all will complete the report or any of the fields themselves. So let's start by looking at how to access the PTR in the EHBs. So as I mentioned earlier, the PTR is submitted in the HRSA EHBs, specifically the PTR web application. You'll need to make sure that your account is set up with the correct permissions to be able to access the report if you are a new user. If you need any help doing that, you can always contact the EHB customer support. So let's start by walking through the step-by-step instructions for accessing the PTR. You'll use these instructions for both Part B and B Supplemental. So starting out here on the home page, after you log in, you're going to hover over the Grants tab at the top of the page. And then in this drop-down menu, which you see here, you're going to select Work on Other Submissions. From there, you're going to be taken to the Submissions All page. And if you scroll down, you should find a list of submissions for your agency. Remember, again, if you have both Part B and B Supplemental Awards, you're going to have two PTRs, kind of like you see on the slide here, two separate reports. To access the PTR system, you'll select the link over here on the right that's under the Options column. Before you've started working on the report, it's going to read Start, and then once you start working on the report, instead it's going to say Edit. From there, you're going to be taken to the PTR inbox. You can see your report in the center of the page in the inbox. To open your report, you're going to select the envelope icon that's under the Action column. The first time you open your report, it's going to say Create. After that, it'll read Open instead. But we're not going to start there, actually. Instead, we're going to begin with the GCMS, which you can access by selecting the Search Contracts link, which is over in the navigation panel on the left side of the screen. So let's take a look at the GCMS before we get into the PTR. The GCMS is a data storage system for Ryan White contract information. Its purpose is to decrease data entry burden on recipients, since the information that's entered there is used for multiple reports. So your contract information, for instance, is also going to be used for the Ryan White Services Report, or RSR, that's done later in the year, thereby eliminating the need to re-enter all of your contract information for that report. So recipients enter their contracts into the GCMS with a separate contract for each agency that's funded to provide services with their award. Then the PTR is automatically going to look in the GCMS for any contracts that overlap the report's budget period and pulls them into the report. PTR specifically is going to pull over contract information to populate your list of CLC section of the PTR, as well as funding amounts for core medical and support services. That's going to populate in the allocations report section. So typically recipients will add their contracts for the budget period into the GCMS during the completion of the PTR. Again, you'll need to make sure that you have a contract for each organization that's funded to provide services. And this does include your own agency if you do provide services. Your agency's contracts in the GCMS should align with the dates of your budget period. So for Part B, that would be April to March. You should not have a contract that exceeds 12 months. Also, prior year's contracts do need to be preserved. Each provider must have a separate contract for each year that they are funded. We're not going to walk through the entire process of adding contracts for this presentation, but we do have step-by-step instructions for that available in the GCMS manual, which is on the RWHAP website. So now that we've taken a brief look at the GCMS, let's talk about the PTR. The first thing I want to mention is the navigation column. It's always there on the left side of the screen while you're in your report, and it's how you will navigate the system and complete your report. Up at the top, you can use the link here to get back to that PTR inbox at any time. As previously discussed, you can access the GCMS by selecting Search Contracts, which is under the Manage Contracts heading. The navigation heading is where you're going to find links for each section of the report itself. Also, under the References heading, you can find the links for both the Validation Rules document and the Part B Supplemental PTR Instructions document. In the Actions section, you'll find the links for both validating and submitting the PTR. And then finally, down towards the bottom, we have options for printing and exporting both the CLC report and the allocations report, should you need either of those separately. So after you click on the envelope icon, you're going to be navigated to the first section of the report, which is recipient information. The fields here are going to be pre-populated from the EHBs, starting with your agency's mailing address up at the top. And then down here, we have your agency's EIN and UEI, and then the contact information of the person that's responsible for the submission. Just make sure everything is accurate and up to date. And if you do make any adjustments to what's on the page, make sure that you select the Save button, which is down at the bottom right. The next section of the report is File Upload. For Part B and B Supplemental, you will have a few files that need to be uploaded with your PTR. We'll go over exactly what those are in just a second. Looking at the file upload section, you do have a couple of tables here. Up at the top, you have a table for reference documents like the PTR instructions, which you'll definitely want to check out for assistance with the files that are listed here. And then further down the page, we have where you're going to actually upload the files themselves. Now, some of the files that you upload are going to have templates available. You'll see them listed here in this top section of the table. You can select the download template link, fill it out, and complete the document, and then select upload over on the right for the appropriate file to add it to your report. For any additional document you need to upload that doesn't use an existing template, you're going to need to use the supplemental document upload feature instead. So for that, you'll just select the Upload Supplemental Document button, locate the document you have saved on your computer, and add it to your report. For the Part B PTR, there are 5 documents that must be included with your submission, which include the SF424A, Budget Narrative Spreadsheet, Implementation Plan, Contract Review Certification, or CRC, and then the Early Identification of Individuals with HIV/AIDS, or EHA plan. For the Part B Supplemental PTR, you have all of those same uploads, except you don't have the EHA plan for that one. If you do have any questions about the required documents for your PTR submission, make sure to reach out to your project officer for help. The next section of the PTR that we're going to discuss is the Consolidated List of Contractors, or CLC report. This is a list of all organizations that are funded to provide services with your agency's grant. The CLC report pulls information directly from the GCMS, and it's going to pull in every contract that overlaps with the budget period and list it here in this section. You want to make sure you review the CLC report for accuracy and completeness by double checking the contract dates, the funding amounts, and the funded services. You can select the expansion button, which is over here on the left, to view the services that are funded for each provider. Again, remember, all agencies that are funded to provide services with your award, including your own if you provide services, should have a contract in the GCMS and then should be listed here in the CLC report as well. If you need any assistance with updating your contracts in GCMS, make sure you can always review the GCMS instruction manual or reach out to us at data support as well. So if you add or edit any contracts in the GCMS after you have started the PTR, you're going to have to synchronize those updates with your report to get the system to add those changes to your report. You'll know the report needs to be synchronized if you see a yellow warning banner at the top of the page, much like you see here on this slide. You do have to synchronize in order for the contract updates to reflect in your report. So make sure that when you're ready to submit, that you don't have any contracts left that need to be synchronized. To synchronize contract updates, you'll select the Synchronize All button, which is in the yellow warning banner. On the next page, you're going to see a summary of the updates that were made to your contracts in the GCMS. Just review them, make sure that they're in line with what you updated in the GCMS, and then select the Synchronize button at the bottom right. Once you've done that, the updates will be added to your report. So now we're going to look at the last section of the report, which is the allocations report. The allocations report is split into a number of different tables. So we're going to just start at the top and scroll down through the page. And we'll walk through Part B first, and then Part B supplemental after that, since there are a few differences between the two. Everything we've presented prior to this point has been the exact same for both of those reports. Now, in both of them, though, you can't leave any fields blank. So if you have no allocations to report for any category, make sure to enter a 0. And also only whole number values are allowed. So no decibels, no cents. So the first section of the Part B X07 PTR is going to be award information. This table is for your total award amounts. There are 5 total fields that you have to fill out, 1 each for your Part B base award, ADAP base award, ADAP Supplemental Award, Emerging Communities Award, and MAI funding. If you don't receive one of those award types, make sure to just enter a 0. The next table is the allocations by program component. So in this table, there are 3 columns, each pertaining to different award types. You have your base award in column 1, ADAP base and ADAP supplemental combined in column 2, and then emerging communities in column 3. There's a few different fields to fill out in this table. We're going to walk through each of the rows here, starting with allocations for ADAP. So ADAP services, ADAP health insurance, and ADAP access, adherence, and monitoring services. So you'll enter the amount from each award type allocated for each of those ADAP services in the appropriate field. Rows 2 and 3 are blacked out. Those are for Part B health insurance premium and cost sharing assistance and home and community-based health services. Allocations for those 2 services for your Part B X07 award are going to be entered into your contracts in the GCMS. Rows 4A through 4D are all going to relate to consortia funding. So if you don't have any consortia funding, then you'll enter a 0 for each of those fields. In 4A, you have 1 field for HIV care consortia from your emerging communities funding. So make sure to fill that out if you have it. And then rows 4B through 4D are for consortia non-client services. So 4B is for consortia administration, 4C for consortia planning and evaluation, and then 4D is for consortia clinical quality management. Down now at the bottom of this table, there are just a few more fields that need to be filled out. Rows 5 and 6 are both going to be entirely pre-populated from the GCMS. It's going to pull values from your contracts. The first for emerging communities funding, and the second for state direct services. In row 7, you're going to enter funding that's allocated for clinical quality management, again from your 3 award types. In row 8, you have planning and evaluation, and then in row 9, you have recipient administration. Moving on to the next table, we have values for all the core medical and support service categories. Everything in this table is going to come directly from the GCMS. So if a value is not correct, you're going to have to modify the associated contracts for those services in the GCMS. And scrolling way past that table, next in this section, you're going to have the MAI allocations by program component table. This table is where you're going to report on all of your MAI funding. You're going to enter values there for MAI education, MAI outreach, and then the non-client services. You have, again, clinical quality management, planning and evaluation, and recipient administration. Keep on scrolling down here. We've got below the MAI table, you're going to see a checkbox for the 75% core medical services requirement. You should select this checkbox if your agency received a waiver for that specific requirement. And if you have any questions about the waiver or if your agency received it, make sure to reach out to your project officer. The last section of this page is the legislative requirements checklist. There's no fields for you to fill out here, but it's definitely very helpful to check this section to make sure that your agency is in compliance with the various requirements of your award. So each field's going to show your allocations as they relate to the associated legislative requirements. All the fields here are going to populate once you have entered and saved your allocations data on this page. The first table that you can use to check for the 75% core medical services requirement. So it'll show your allocations as they relate to that requirement. And then the next box you'll see is for clinical quality management. You can check that your clinical quality management allocations don't exceed 5% of your award or $3 million, whichever is smaller. You can check that here. And then the last box is for planning and evaluation and recipient administration. So planning and evaluation and recipient administration each can't exceed 10% of your award, and then the two combined can't exceed 15% of your award. So once you've gone through this whole page and you've entered your agency's allocations, you'll want to make sure that you select the Save button, which is down there on the bottom right. Like I said, once you save your allocations data on this page, that's when you'll be able to look at the requirements checklist to make sure that. So we're going to switch gears, quickly review the allocations report for Part B supplemental grants. The section for Part B supplemental awards is a bit simpler. There's only 10 fields total that have to be completed. Starting at the top, you have award information with just the one field. It's for your agency's total XO8 award amount. And then next is the planned funding by program component table. This is similar to what we just went over for Part B XO7, but you just have the one column for the one award type. First 3 rows, again, are all for ADAP services, health insurance, and access adherence and monitoring services. Unlike Part B XO7, Part B supplemental does not have rows 2 and 3 blacked out. So for your Part B supplemental award, You have to report allocations for health insurance premium and cost sharing assistance and home and community-based health services. Both of those go in this table in your allocations report and not in your agency's contracts in the GCMS. Rows 4A and 4B are again for consortia funding. 4A is going to populate with your agency's consortia funding total that's entered into contracts in the GCMS. And then in 4B, you're going to enter the amount for consortia administration if you have that. Row 5 is going to populate with the total of your agency's direct services funding that's entered into contracts in the GCMS. And then rows 6, 7, and 8, those same non-client services we saw before: clinical quality management, planning and evaluation, and recipient administration. Just like for Part B, XO7, the last table here is it's going to be for your core medical and support service allocations. Again, all these values are going to come entirely from the GCMS. So if you need to make an update to one of the amounts here, you do have to modify the associated contracts for that service in the GCMS. At the very bottom of that core medical and support services table, you also have the core medical services requirement waiver checkbox. Again, select this checkbox if your agency received a waiver for that requirement. And if you have questions, reach out to your project officer. So now that you've completed and you've saved each section of the report, you're ready to move on to validating it. You can validate the report by clicking on Validate, which is going to be under the Actions header in the navigation panel. Once you do that, the system's going to let you know that it's processing your validation request, and it may take a few minutes to complete. Just wait a couple of minutes, select Validate again, and that will refresh the page. If you see a green congratulations message, then you have no validations to address and can continue to submitting your report. Otherwise, you'll see a table of validation results. So there's 3 different types of validation messages that you can receive in your report, those being errors, warnings, and alerts. Errors have to be corrected. You can't submit your report with an error. So if you receive one on your report, you'll have to adjust your allocations or your report based on that message, save that, and revalidate. Warnings should be addressed whenever possible to prevent your project officer from returning the report back to you for changes. But you can still submit your report with a warning by adding a comment for each one that you receive. Alerts, again, we always recommend try to address them whenever you can, but you can still submit your report with 1 or more alerts. If you make any changes to your report after validating, make sure that you validate again using the steps we reviewed on the last slide. So here's a sample validation results page. If we scroll down the page a little bit, in this particular example, this recipient has 1 error because their clinical quality management allocations are too high. So in this case, they would need to adjust their allocations, lower that amount for clinical quality management, and then revalidate. The last step is then to submit your report. To do that, you'll select Submit in the navigation panel on the left side of the screen. On the next page that shows up, that's what you see here on the slide, you're going to enter a comment in the text box with any meaningful feedback that you have about your submission. Select the checkbox certifying the data in your report are accurate and complete. And lastly, select the Submit button. We get this question quite often. If you do need to make changes to your report after you have submitted it, ask your project officer to return the report back to you for changes. So we've come to the end of our presentation for today. If you have any additional questions, please feel free to ask them during the Q&A portion, which we'll get to in just a moment. But first, I'm going to pull up some of the resources available to assist you if you need any additional assistance. So the RWHAP website is where we currently have all of our online resources. The first link here is for the recipient resources page, which is going to include the both of the PTR manuals and the GCMS manual. And then the second link we have is for the HAB policy notices page, which includes PCN 1602, which is the document that houses the definitions for all core medical and support service categories. The two main TA resources you may need for the PTR are going to be us at Data Support and then the EHB's Customer Support Center. So myself and Denise, we're both from Data Support, and we can help with accessing and completing the PTR, as well as making any changes to the contracts in the GCMS. The EHB's Customer Support Center will be your contact for any login or issues with account permissions. But remember, there's no wrong door for TA, so no matter who you contact, we'll make sure to get you to the right place wherever we can best help you. So thank you again, everybody, for joining us on today's presentation. I'm going to turn it back over to Denise to start the Q&A.